Well, good morning. It's great to see you all. You are for a very special treat. As Maureen said, with us today is one of our long-term patients, Cynthia Burr, and her husband joined us, Michael, and so we're glad to have Michael. But Cy, we first became acquaintances through my blog, and so I thought this was a great opportunity for us in connecting the dots. Let's bring it back to what we're really focused about every day, and that's the patient. So, Cy, you've gotten to see the transitions and the transformation that St. Luke's has been undergoing these past few years. What have you noticed about the changes?
One of the things that I noticed about St. Luke's, first of all, my best friend, Barbara Wilson, has been a longtime board member. My husband, Michael, knew of Dr. Jeffrey Swanson and introduced him to me. And I had a horrific white coat syndrome problem, so I refused to go to doctors. 25 years, well, now almost 30 years ago, I had Hodgkin's disease and I was fearful, and the system was different, and the health system was, it was in Canada, but I suspect it was much similar to, the way the processes and the procedures they had here. So Jeffrey walked me through and got rid of the white coat syndrome. He educated me. He educated me to be a participant in my healthcare rather than just a recipient. And I feel safe and secure at St. Luke's. And I see the teamwork and the partnership, and I see it changing. The systems, I watch very carefully. I can now go online and see what my last appointment, what my blood work is like. So I answered your blog because I'm very excited about what St. Luke's is doing.
Well, that's marvelous. And great work to all the My St. Luke's folks out there. That's great. What are some things that you observe that we could be doing better?
Well, first, billing. I can never understand. I can never understand my statements. So I hear there are some changes coming down the pipeline.
There are changes coming.
Yeah, so yay, go, whoever's working on the billing, go for it. Other improvements. You guys do so many things so well that I do feel safe and secure, which is so different. I had a fear of walking into a hospital. It would make me sick because of my experience at the imprinted years ago. But it's the little things, the teamwork, the communication and education, patient education, and the patient's responsibility role is very important. But checklists before going into surgery. I've had so many procedures and surgeries. Some have gone beautifully, and some have not gone beautifully. And so even like a checklist, a sign. When I walk into the hospital now, I say to myself, okay, do your best. Just do your best. And on some days it's not so great. Other days it's, not bad. I'd like the other individual on the other side to be saying the same thing when they walk through the door to see me. I'm going to do my best. They may have had a terrible day. Maybe they got some bad news at home from the family. But do your best. So it's very hard to say, what could you improve on? So there's the little things, but you're great caregivers, and it shows, and I've seen it, and I've seen the changes. Your systems, your doctors can communicate to each other. My team, Dr. Jeffrey Swanson, he's our family physician, Dr. John Swardloff, my oncologist, my surgeon, Jan Getz. I mean, they're all different personalities, but they all have the same philosophy, and they work together as a team. And you can see it when you walk in their staff, and the way they talk together, and how I can talk to the triage nurses and get information. And they get to know the patient very quickly. And it's my responsibility to help them to get to know me. So communication and education. I think St. Luke's could do better by having an education program for patients. Because patients are fearful, they use the emergency room instead of the doctor's office. They shouldn't be there. You know, and a hospital can educate individuals as to how to use them appropriately, and not to be fearful, and they're not going to be judged. That it is a partnership.
Let me ask you more about, you talked about how important the communication is and the teamwork. Mm-hmm. And I would imagine with someone like you that's requiring a lot of different services, you've been through an awful lot, you've got your medical treatments, your surgical treatments and all. Talk for a minute about how important that care coordination is and how well we're doing in terms of, you move from setting to setting. You're getting some treatments at Misty, you're getting some inpatient services. So how important is that care coordination and the transitions of care for someone like you?
Oh, it's huge. And I've been in every department. I've met so many of the individuals here. I have a CAT scan every 3 months. The coordination and the communication, they can see and pull up my information so that I'm not always having to re-explain. The girls in the CT scan room, I've been in Meridian, I've been in Eagle, I've been downtown. I mean, they all know me. And they talk to each other too. And so she, Cy needs, pillow behind her neck, under her knees. They make that effort. But your system, I'm not exactly sure what you have set up now, but one of the things I've noticed differently is people can go in on the system and see, oh, you've got an appointment at such and such a date. So I had a mammogram, and one of my big concerns was it was so deep. I had a lumpectomy, and instead of mastectomy, just given the fact that, I'm going for quality of life rather than quantity of life. And I make these decisions with my doctors. One of the fantastic things was like this communication between departments. I'm in downtown Boise getting these special mammograms, and I just happened to ask the nurse, I said, can I talk to the radiologist? And she goes, oh, sure, let me check. And I'm going, oh, really? I mean, that wouldn't have happened maybe 4 years ago, or certainly not 25 years ago. But she comes back to, yeah, he's free. So I walked into this room, and it's just like this computer control room. And he's sitting back, and he's going, hey, have a chair. And I've met him before. I think I've met them all. There's so many, different screenings and stuff. But, he said, it shows benign. But one of my big concerns was that the cancer previously was so deep that it didn't show up on mammograms before. So I said, okay, we know there's no new cancer there in that area, but the other mammograms didn't show it either, but the CT scans did. And he goes, oh, but you're set up for 2 weeks down the line. The CT scan is going to take a look at the original spot of which I've got a little metal tag. And so this information that this radiologist, who isn't necessarily, he's a part of the bigger team, because several different radiologists look at me and my scans. Mm-hmm. They're probably getting to know me by now. It's been over 3.5 years, and every 3 months, my name keeps coming up, and they're probably going, who is this woman, But so that the communication, it's huge, absolutely huge, and you're doing it well. But there's always room for improvement.
You know, talking about connecting the dots, if you think about our vision statement, what we talk about is that we want to provide seamless integrated care. And a lot of times our folks are trying to understand, you know, what does that exactly mean? And, you know, we've said that, you know, the integration needs to be kind of from the provider standpoint. Do I have access to the information? That's why we're doing my St. Luke's, all these things. Do we have all this information? But the seamlessness needs to be from the patient's perspective. And what I hear you talking about is how critical that's been for your care, because you've got many different physicians providing care in many different settings, but you've been comforted by the fact that they all have your information. It'd probably take a long time to go through your history with every person. And the fact that, like, even with this radiologist, that he knew, well, as far as the treatment plan, it's not just today I'm reading your mammogram, I see you have a CAT scan scheduled in 2 weeks.
Certainly.
So it must be critical for you.
It is very critical because waiting is difficult, waiting to hear news. Once you know what you're facing, then, you know, you can, you know, step up to the plate and go, okay, now where do we go? And I feel like I am a part of the game plan. Years ago, and at the beginning, before I was educated, I felt like I had no sense of control. And when you're diagnosed with an incurable, inoperable cancer, you're kind of, you go into, you know, kind of like a shock mode, and there's different, people react, everybody reacts differently. So every patient that walks through that door is going to react differently. But every doctor, every caregiver is different and deal with people differently. But that information and getting it back very quickly is absolutely huge, because you know what you're facing and you get rid of the fear. So that sense of safety, security, information back to you quickly, the more seamless your system can be, it's absolutely huge. And patients have to take a bigger role in asking for that information. It's there and finding it. But how do you do that? Well, I would suggest you as the St. Luke's team go, okay, let's educate our clients on a one-to-one basis, even if it's like one brief statement. Give them some education while they're there. What you tell us is important, because we don't know if you don't tell us. They don't know that if I lay down straight without something behind my back, my back literally cramps up just by virtue of the shape of my spine, and I'm in a lot of pain. So it's a matter of, I need to tell people that. They're not, you can't read minds. So it's definitely a partnership. So if St. Luke's can really bump up with the education of patients so that they can take a responsibility. I mean, humanity, we're talking a huge spectrum. Everybody's different that walks through that door, different levels of education, intelligence, backgrounds, financial situations. So you're dealing with everything across the board. But I think education is the key, absolutely, for patients so that they can take responsibility.
And I want to just connect another dot, because we use different terminology than what you've just heard a patient talk about. But what you've been describing at various parts through our conversation is we talk about we need to be patient-centered. And to understand what does that mean, you've really heard that from Cy, and I'll see if you want to amplify, but the points that I've heard was everybody's different, we all learn differently, we need to understand, we need to be a participant in our care, and we need results sooner, and we need to be engaged in this care. Anything else that you want to amplify about what it means to be patient-centered, and maybe your observations? You've been getting treatment from the healthcare system for a long time, how that has changed to how we used to treat patients.
So a big shout out. Where's the maintenance team? Where is the maintenance team? Anybody here? Managers that take care of the janitorial services or whatever. Shout out to your staff how important they are. Thank you. If you walk into a hospital and you're scared, you're going to get infected. This is not a good sign. you're in the background, but we see these individuals come in and taking care of the place. And when you take care of your place, you're taking care of your clients. So everybody in St. Luke's, it's huge, the responsibility about how safe a client feels. Frank in the ICU, he was, never saw him smile. Never saw him smile. But let me tell you, you know, I wake up, he said, I'm Frank, I'm here to take care of you. I said, hi, Frank. And did he take care of me in the ICU? And he got me to my room. So he wasn't a wooey, touchy-feely thing, but I had great confidence in Frank. So I don't care if you're, you know, all smiles and chuckles, but if I feel confident and safe, I mean, that's absolutely huge.
One of the things that is a focus for us is patient satisfaction. And we're making a real big focus on service to patients across our health system. And one of the things that I've shared before is that a lot of times when I get letters from patients, you know, they really expect great things from the physicians and nurses, but their expectations are exceeded when other people play a role. And you just gave a shout out to environmental services and so forth. It's amazing how often the letters I get are about that. And somebody that comes in the room and just, they have a job to do, but they take a second to connect with you and to seem to care about you and all. Tell us from your standpoint, what are the things that make for a better experience when you're in the hospital?
The little things, again, like where you feel safe. You know, I've had some good experiences and bad experiences. Great experiences and not so great. And I remember you guys have to face so much the patients don't really think about. But just the smile, the connection. And if you're having a bad day, it's like walking through that door again and saying, I'm going to do my best. And communicate with that individual on whatever level you can. Everybody's different, right? But a smile, just even, you know, a pat on the shoulder, just, you know, put your head through the door. How you doing? Need anything? Okay, fine, and be on your way. Just these small connections. I remember one night, I was in the hospital for 10 days, and there was this guy down the line. Generally, I mean, I had peace and quiet. I mean, they'd come in and check, you know, your vital signs and all that other kind of stuff on an hourly basis. You guys take great pleasure in waking everybody up as often as you can. And so you get such great sleep at the hospital. But it's necessary. But you can't be perfect, but you can do your best. And patients can't be perfect patients all the time, but they can do your best. So I wish there were signs everywhere that just said do your best, and hopefully it would promote, well, what does that mean, do my best? And then you as a health provider could say, well, every time we walk into a room, it reminds us, okay, we're here to do our best. And as well, I mean, if you have a chance to educate a patient then, and if you do your best, we're going to be a really good team. But back to the room, I mean, it was peaceful, it was quiet, it was fine. But there was this guy one night that was just screaming and moaning all night long, and I'm going, I would hate to be his caregivers, you know. So by 2 o'clock in the morning, I'm going, give him morphine, you know, do something, you know. And I'm going, if I ding, if I have a heart attack, I'm like, you know, do I have to scream louder than him? It's like, so I don't know. You have to put up with so much. I understand that, but you know, if you can just, you know, go in and do your best.
You know, I want to kind of close my last question on a tough and uncomfortable issue. Okay. It may be more uncomfortable for us than for you.
Probably.
You know, in all frankness, you have a terminal illness.
Yes, I do.
And what can you teach us as caregivers about how to deal with those issues with you? In terms of, you know, I think I've even known doctors who are uncomfortable talking about end-of-life issues. And probably just now that I've said end of life, half the room is cringing.
Yeah.
But
we
you know,
do.
you have an amazing spirit, and so I'd just like you to talk to us about when you were confronted with those kind of issues. Did you want us to beat around the bush? Did you want us to be frank and open? Did you want us having that conversation with you alone? Was that a family thing? How do you deal with that, and how can we help?
Yeah. Well. Fear. Fear dominates everybody's life, whether it's health issues, financial issues. We have a fear of dying. And I do not fear dying. When it's time for my end, it's time for my end. I have no fear of dying, of being, you know, coming to my end. What I am very conscious and fearful of is the process. I want to come to my end with grace and dignity. And I believe it is huge, and I communicate it to my family, my doctors, my caregivers, that we're humans. We need to be humane to each other. And nobody wants to talk about it. And the idea is, no, talk about it. Make it a more comfortable subject. We are coming into an age where there's going to be a lot of elder care, and the families need to be educated. I would suspect, you may or may not agree with me, but the biggest problem when someone is dying and they're in the hospital is that the family interferes. The individual wants to go. They're suffering, but they're afraid to let go because of the family. So have an education center on how people to deal with grief and end of life, and have some experts come in and teach that to individuals. Again, it's patient education again, and family education. And we really need to do that, and we need to talk about end of life and end of care, and get rid of the fear. And the moment of death, sharing someone's moment of death, is just as precious, if not more, as sharing the moment of birth. It's, you know, you're celebrating, that person's within you, you are within that person. If you're there at their deathbed, if you're a caretaker, you've been a part of their life. And it's absolutely huge that it be addressed openly, without fear, and with respect and dignity and grace.
We actually are at the end of our time for the segment, and I just want to tell you what a special person you are. To not only give us the honor of caring for you, but to share your perspective with all of us. We're very grateful. We wish you well.
Thank
God
you.
bless you. Whatever we can do to help, let us know.
Well, I feel very well taken care of. And thank you for letting me come and share my thoughts. Rattled sometimes they are, but.
Help me thank Cy Burr.
Thank you.